Mankind has always battled obstacles like poverty, disasters, and disease. Amongst the many diseases that have plagued mankind, the human immunodeficiency virus HIV, which leads to the acquired immune deficiency syndrome AIDS, has been a major source of concern and a fearsome killer long before it was first isolated and discovered over 3 decades ago. But mankind is fighting back. Research is ongoing to find the cure for HIV. Until there is a permanent solution, anti-retroviral drugs have been produced to control the devastating effect of the virus, which gives the person living with HIV more time to live a fulfilled life. Governments and organizations all over the world have taken giant steps towards battling this scourge. Funds running into billions of dollars have been poured into the fight, and the skills to help provide healthcare and win the war against HIV are being utilized daily. By providing round-the-clock service to create a buffer and find a solution to the pandemic that has claimed the lives of many, such organizations provide medical support and training, sensitization and empowerment programs, social infrastructure, follow-up services, and so much more to people living with the virus and those that are in danger of being infected. One of such organizations is Caritas Nigeria, formally registered in 2010 as the specialized agency of the Catholic Bishops' Conference of Nigeria, CBCN, for relief and development.
We advance the well-being of all through participatory measures in line with the Catholic social teaching.
Caritas Nigeria got a grant from the Center for Disease Control and Prevention, or CDC, to execute the Sustainable HIV Care and Treatment Action in Nigeria, otherwise known as SUSTAIN, a HIV/AIDS treatment program aimed at reducing the scourge of the disease by identifying and treating those affected.
The SUSTAIN project started implementation in 13 states in 2012, but due to the rationalization of HIV care and treatment services in Nigeria, we stopped services in some of the states. But up until now, we are providing services in 12 states. In the North Central, we're working in Benue, Nasarawa Plateau, the FCT and Kogi states. And in Northwest, we're working in Kaduna State. In South-South, we're working in Delta State. And in the Southwest, we're working in Lagos State, Oyo, Ogun, Osun, and Ondo states.
As one of the states that has greatly benefited from SUSTAIN, Benue is very strategic in implementing most of the components of the project.
As a region, we have contributed about 67% of the total patient pool for Caritas Nigeria. As at August 2017, the total patients under Caritas Nigeria care was about 63,000, and from the region alone, we have about 42,000 of these patients. We have also tried in establishing a good working relationship with the state government by contributing technically and financially to the success of some of their projects in the state.
Caritas Nigeria focuses on fortification of already existing health facilities. Using these platforms to strengthen institutions and build capacity ensures that people living with HIV/AIDS have access to better quality health care.
We offer various kinds of support to ensure that they have a quality of service. And our major goal is not just having a quality of service, but making sure that they have a good turnaround time. We go into a facility, and the first thing we do is look at the kind of facility we are having. Does it allow for safety of patient and personnel? Is it good? Does it meet the standard required for such activity? We have done renovations. We have provided every of our laboratory certain equipment approved by the donors.
Most of the equipment that has been given to the facility has improved the way that work is being done, such as to make those who are also working very comfortable and happy.
CCFN has really done very well with the Daughters of Charity Hospital. They have able to support starting from community mobilization. They supported in those areas very well. And at the same time, they're able to support with some laboratory consumables, laboratory reagents, and some HIV program test kits. And at the same time, they look at some of the equipments that we don't really have on ground, then they're able to provide them adequately, which really help assist the hospital to care for the patients accordingly.
Unborn and nursing babies are some of the most risk-prone demographics to HIV and AIDS. Caritas has recorded immense success in stemming the tide of babies that are infected with the virus from their mothers through the prevention of mother-to-child transmission of HIV and AIDS, or the PMTCT Program.
The goal of PMTCT is to prevent or at least minimize vertical transmission of HIV, which means prevention of transmission from mother to her unborn child. It has been challenging reaching pregnant women in various places where they are, both in the facilities and in the communities. We have been able to enable over 1 million women know their HIV status, and amongst them, all the women that are positive have been linked to HIV care and treatment, and their exposed infants enabled to assess early infant diagnosis.
Opportunistic infections, or OI, are diseases which arise because of the diminished immunity of HIV patients. One of the deadliest of such opportunistic infections is tuberculosis.
The World Health Organization designed a program for this category of people, and this program is planted inside the HIV program. So what we do is that we integrate TB treatment into the existing structure of HIV management.
Accessing HIV care and medication does not come cheap. In ensuring that patients are tested and receive the appropriate medication as at when due, the Pharmacy and Supply Chain Management Unit of Caritas works hard to guarantee that these commodities are made available at the right time and in the right quantity.
Before the Sustained project, there were limited facilities in the areas where we're presently covering. And so patients had to source for drugs and pay from pockets. And we know very well that those drugs are very expensive. Caritas Nigeria is trying to work towards seeing an AIDS-free generation. So to ensure that you have an AIDS-free generation, every Nigerian has to test for HIV. So on our part, we make sure that the HIV test kits are made available free of charge for those who want to test, to know their status, to test. And anybody who is found positive, we also ensure that drugs, the ARVs, are available for such clients.
Quality care is a non-negotiable element in all the facilities that Caritas is affiliated with. By routinely monitoring activities, they can ensure that all operations and systems are up to standard and improvement plans are in place where they are lacking.
In order to get this, we have a series of activities that we're engaged in, which are documentation audits. We have the retention analysis, which comprises of mortality reviews and also loss to follow-up reviews. And we also carry out the small test of change, which is the model of improvement that Caritas Nigeria uses to improve on areas where patients are not getting the best care. Caritas Nigeria has been involved in program implementation on the Nigerian QOL implementation since inception. And we have been able to train a number of facilities to carry out this activity. In total, 72 participants have been trained across 37 facilities. We come up with a national quality improvement activity. We call it the NQIP. And CCFN facilities have participated during the last 3 national quality improvement activities, and we're able to present at the state level meetings our improvement activities. And among this number of facilities, one of our facilities, SON Jikoi, won a national award following the implementation of this national improvement activity, Nigerian QOL.
Before Caritas partner with us, we have problems of record keeping. We also had logistic problems. And after they partner with us, Most, if not all, of these problems are being tackled. For example, we have constant supply of drugs now.
Managing the magnitude of data that Caritas gathers is a Herculean task. By using the electronic medical record system, the Strategic Information Unit ensures that all milestones of the project are tracked and there is adequate monitoring and evaluation, quality improvement, and data demand information. By building the capacity of all partners, proper records can be kept and accurate reports given.
Having electronic medical systems gives you the advantage of quick retrieval of data, and it is better managed when you have clients' data in a database that you can update as you provide services. We have ensured that the EMR rollout is part of our activation package. So whenever we go out to activate any new site, we ensure that those sites also have the EMRs as part of the startup plan. We have been able to test over 3 million persons for HIV. We have placed over 66,000 persons on treatment for those that were identified positive. For the pregnant women, we have reached out to over 261,000. We have placed 14,000 of such positive pregnant women on treatment. We have equally done over 14,000 tests for unborn infants.
The Nigerian government, alongside some of her international development partners, conceived the idea of designing a national data repository, which is a repository for health data regarding all diseases of public health relevance across the country. Under the SUSTAIN project, Caritas Nigeria is executing this plan, pioneering with HIV/AIDS data.
Over the years, program planning and implementation of programs relating to health has become increasingly data-driven. With as much data, planning will be more precise, data will be available for analysis, and gaps can easily be identified. Where there is need that is localized to certain areas, it will be visible from the data. And so it is possible for us to be more efficient with resources.
Working hand in hand with faith-based organizations, especially the church, leveraging on the reach of these organizations to get to the people in communities, has proven successful in ensuring that they are well informed about HIV and AIDS testing and care services. Closely ingrained in the PMTCT program is the Baby Shower Project, organized by congregational heads.
Working with the church is of great interest because there is a lot of opportunity with the church. There are so many structures that you can work with to achieve your target, especially in terms of health in the rural communities. Most of the people we are trying to reach are in this community with their pastors in place. They listen more to the pastor. So if you go close to the pastor, if you work with the pastor, you should be able to implement most of your projects.
PMTCT program was very difficult to hit the target because not so many will come to the hospital for antenatal care. But when this program came on board, you have some people who go into the churches on Sundays in particular, and then if they are having programs in churches, they go there, talk to the people, and test the pregnant women. So if any pregnant woman tests positive, they refer them to the facility for care. It helped to boost the number of pregnant women we have tested. It boosts the number of HIV positive pregnant women we placed on care, and that, in a way, has helped to reach out to so many who ordinarily wouldn't have come.
The baby shower program offered us an opportunity to be invited to the church and get tested for free. The baby shower program gave us free gifts, which includes the mama pack and the delivery kit. When I got to the hospital for delivery, I was not faced with the hurdle of having to buy them. I have my materials already. The celebratory mood that the baby shower provides us makes us alleviate the anxiety that we pregnant women always pass through, since it is a challenging period in our lives.
Many of the people who require healthcare live in hard-to-reach areas. Caritas Nigeria has come up with a range of innovations that has taken healthcare closer to the people through the Community ART program. From regions in Benue to as far as Bumadi in Delta State, Caritas defies the distance and takes help to those who need it the most.
Community ART service is actually a strategy that takes the service to the people right where they live. And one of the ways we have done this is to identify community platforms. That's now informed the reason why we have to procure a machine we call the E-Ranger machine. The E-Ranger machine is a mobile clinic, and it has all the paraphernalia of what to expect a clinic to have. The machine is managed by trained healthcare and experienced healthcare workers. And the machine has both laboratory and drugs, as well as medical equipment, support, and they are able to provide those services right there at the facility in the community.
With the help of the Sustain program, we have been able to reach out to our plants in the creek. They have been able to provide money for tracking patients, because most times they find it difficult to come down here due to the transport fare. But with the help of the Sustain program, this has been very easy for us to reach out across to them, and it has prevented a lot of preventable deaths.
The HIV/AIDS scourge does not only affect positive clients, but renders entire households vulnerable to infection. The goal of the Sustain OVC program is to improve quality of life in vulnerable households.
Because of the HIV pandemic, a lot of families were ravaged, and it made a lot of children, orphaned and vulnerable. We've been able to serve 33,500 vulnerable children across 923 households. Our main FOCOM strategy is for us to ensure that we build the capacity of these vulnerable households so that they will be self-reliant to be able to take care of their wards.
Helen Niayen is an example of a caregiver that was strengthened through the OVC program.
My husband got sick 2 to 3 months, and we take it to the hospital. My husband died. He left me with 3 children. At times, we cannot find difficult to pay our school fees. The organization helped me to pay my children's school fees.
The Grants and Compliance Unit is the financial muscle that has held the entire Sustain project together from inception to conclusion.
Before the project went to some of these facilities, most of them didn't have proper financial systems in place. You could go to a facility and then they didn't have a bank account. There were no receipts to even account for monies that were received. So when we got to these facilities, we were able to work with them to ensure that their financial systems were built. We ensured that they had receipts, and then we were able to have proper internal control processes where no one is paying monies, receiving and then writing checks at the same time.
Overall, the Sustain project has been a huge success. Because of the doggedness and commitment of the various staff that make up Caritas Nigeria, various lessons learned across all the units have helped to strengthen them, equipping them for future projects.
I think that going forward, the donor and all the implementing partners need to work with the government of Nigeria to see how much the government of Nigeria can commit to HIV care and treatment program generally.
It's important to underscore the role that donor agencies play in developmental programs, and want to take this opportunity to thank PEPFAR and the Centers for Disease Control, CDC, for not just the resources that they've made available to help Caritas Nigeria implement the Sustain program, but the vision, the technical support, and the collaboration between their organization and ours was a learning experience for us and has positioned us as an organization for future developmental activities.
The Catholic Bishops' Conference of Nigeria, CBCN, deeply appreciates the support of the United States government that funded the SUSTAIN project through the President's Emergency Plan for AIDS Relief PEPFAR and the Center for Disease Control and Prevention, CDC. Thank you for helping us bring succor to our brothers and sisters in need.
No so long time ago, there was a small town that harvested food where they received a meal. After being sure that people get what they need,
they gather happy and joyful and humble in their acts, which is the sign of the presence of our living God. I'm done with this world.